Hi, my name is Grismel, and this is the chapter 23. The heart and circulation 2. Physical examination. Medical examination is normally carried out in 4 stages: inspection, looking, palpation, feeling with the hands, percussion, tapping with a finger, and esculation, listening with the stethoscope. Note: the verb is palpate. The noun is palpation, no palpitation. See in Unit 22. Examining the heart and circulation. There is an extract from a textbook description of how to examine the cardiovascular system. Look at the limbs, tongue, and nails for the blood discoloration diagnosis. Diagnosis may be central or peripheral. Inspect the hands for blood clotting. Feel the radial pulse at the wrist and note the rate. For example, 70 minutes breathing, regular or irregular. The pulse may be irregular in force as well as time. Check at the other peripheral pulse and present. Measure the blood pressure and assess the jugular venous pressure, JVP. Palpate the chest from the apex pit. The normal position is the first left intercostal space, 1 centimeter medial to the mid-clavicular line. Feel for any trills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds. For example, filtration groups beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and round. Note: the time of any murmur is relatation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of systolic, pen-systolic, lasting for the whole of systolic, early diastolic, mid-diastolic, late diastolic, pre-systolic. Okay. Continue by listening and the tricuspid, aortic, and pulmonary areas. Areas of esculation. The letters indicate the approximate position of the heart's valves. P, pulmonary valve. A, aortic valve. M, mitral valve. T, tricuspid valve. The circles indicate the position from esculation for cardiac murmurs. Indicating valvular heart disease, the risks are numbered. Chapter 23 en Spanish. El corazón y la circulación 2. 1. Examen físico. El examen médico normalmente se lleva a cabo en 4 etapas: inspección, mirar, palpación, tocar con las manos, percusión, golpear con un dedo, y auscultación, escuchar con el estetoscopio. Nota: el verbo es palpar y el sustantivo es palpación, no palpitación. Ok. B. Examen del corazón y la circulación aquí. A. y la circulación. Aquí hay un extracto de la descripción de un libro de texto sobre cómo examinar el sistema cardiovascular. Mire los labios, la lengua y las uñas en busca de un color azul de la cianosis. La cianosis puede ser central o periférica. Inspeccione las manos en busca de hipocratismo. Sienta el pulso radial en la muñeca y observe la frecuencia. Por ejemplo, 70 minutos y el ritmo regular o irregular. El pulso puede ser irregular tanto en fuerza como en tiempo. Verifique que los otros pulsos periféricos estén presentes. Mida la presión arterial y evalúe la presión venosa yugular, JVP. Palpe el tórax en busca del latido del vértice. La posición normal es el quinto espacio intercostal izquierdo, 1 centímetro medial a la línea clavicular media. Siente cualquier emoción, el tamaño del corazón se puede medir por percusión. Escuche si hay soplos y otros sonidos anormales, por ejemplo, rosaduras comenzando en el área mitral. Los soplos pueden ser suaves o fuertes. Un murmullo áspero es fuerte y áspero. Tenga en cuenta el tiempo de cualquier soplo en relación con el ciclo cardíaco. Los soplos más comunes son mesiostílica en la mitad de la sístole, pansistólica que dura todo el sístole, diastólica temprana, mesodiastólica, diastólica tardía, persistólica. Continúa escuchando la tricúspide, la aorta y áreas pulmonares. Zonas de auscultación. Las letras indican la posición aproximada de las válvulas cardíacas. P, válvula pulmonar. A, válvula aórtica. M, válvula mitral, válvula tricúspide. En T. Los artículos indican la posición para la auscultación de soplos cardíacos que indican enfermedad cardíaca valvular. Las costillas están numeradas. This is the exercise of chapter 23. 23.1. Complete the table with words from A opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb. Auscultate. Examine, inspect, palpate, percuss. Noun. Auscultation, examination, inspection, palpation, percussion. 23.2. Put the steps of examining the heart and circulation in order, according to the four-stage system. Look at A opposite to help you. A. Measure at the heart size. Percussion. B. Are there any murmurs? Auscultation. C. Feel the radial pulse. Palpation. D. Look at clubbing. Inspection. A. Locate the apex beat. Palpation. F. Note any stress. Palpation. 23.3. A doctor is presenting a case of a 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was perexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130 to 80, and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present, and there was not central or peripheral diagnosis. Her apex beat was displaced to the anterior axillary line, but still in the first intercostal space. Her beat sounds were very interesting when she was initially examining. It was noted that she had pensystolic and diastolic murmurs. Her beats best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the precordium. Our diagnosis at the time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation.